Thank you. Good afternoon, prospective chairpersons. Hello, everyone. Um, so, I'm going to talk about how to avoid peaks and dangerous valleys in exercise and type 1 diabetes. Our esteemed chairperson has talked about many celebrities living across the world. I think a lot of those celebrities are present in this hall today. And with or without technology, children, youth, and even adults, and I would say even senior adults are doing very well in the country. The picture has changed. The whole spectrum that when we started work 25 years ago versus what is today is definitely different. So I think at a beginning, I would like to make a heartfelt expression here that all of you, whether you're working in the space of type 1 diabetes directly or indirectly, because if you're in this hall, there is some connect and do have the belief that people living with type 1 diabetes can absolutely do anything and everything. It is, I think, except going into the army, and currently they can't be pilots in India. Other than that, in Canada, even being a pilot is allowed as a person with type 1 diabetes, but Indian rules do not allow you to become a pilot and army. Other than that, there is absolutely no legal parameter of things that you can't do. So, exercise is just a very small part of it, which definitely children with diabetes must and can do. So, this is one of the treks. I mean, all of these, I can see all the champions here. The girl in the orange t shirt making everyone warm up before the trek is Riddhi, who's sitting right here. All of these children here, I mean, I call them kids. They're now brand ambassadors and advocates. They run marathons, and they don't need this teaching. It will be like I learn from them, and that is because they live it, they know how to do it. What I'm going to do is only go through the very basics, and I sort of designed this for, I thought the audience would be physicians who don't take care of type 1 diabetes, and my purpose was to sensitize them to exercise and how to take care of it. So, first thought is, as always, that please ask everyone living with type 1 diabetes to exercise, to go into sports, and ultimately, with due care, they can go into competitive sports as well. So, there's so many factors, right? So, there is the type of exercise factor, the environment, whether you're in heat, cold, humidity, altitude, if you're doing a hill run, there are regimen changes, what is the blood sugar level in the beginning, what are your circulatory insulin on board, whether you're an AID, whether you're an MDI, what food did you have, when did you have, all the bodily concerns. Imagine which phase of menstrual cycle are you in. That's going to make a difference. Of course, hydration, nutritional status, the muscle glycogen levels, physical and mental stress. That itself is a huge factor. Hypoglycemia associated autonomic failure is something very important. If there has been a recent hypoglycemia and person has autonomic neuropathy, so that again is something to be considered. And that doesn't end there. There are still so many factors. So this is not like a lecture where you're learning theory, because if you search it, you will find volumes and volumes and volumes. It's a science by itself. Recently, RSSTI has come up with guidelines, and that guidelines are going to be released very shortly. And those are the nutrition guidelines, which also covers the sports and physical activity as a chapter. So point is that whoever is working in this space and guiding people living with type 1 diabetes, please be aware that there are so many factors, and it's like a mathematical challenge for a person living with diabetes to actually consider and rope in all those factors. But broadly, one can just think of it could be aerobic, it could be anaerobic, it could be combination activities. For the longest time, an average layperson always thought that blood sugar level will drop with exercise. When I used to tell my kids in Udan that, okay, now you're gymming, your sugar's going to rise. They used to say, how can that happen? We are exercising. Our sugar's going to be dropping. Because that's a layman thought in community. And as doctors, we know that it doesn't happen that way. But unless and until we explain it to the person living with type 1 diabetes, they will not realize that their sugar shot up after they did their whole resistance training. So we have to know that for aerobic activities, which tend to be longer in duration, but lower in intensity, intensity. Except the blood, expect the blood glucose to drop for anaerobic activities, which tend to be shorter duration but higher in intensity. Expect the blood glucose level to spike. And mixed activity. You are playing a game of basketball, badminton. There is muscle activity, anaerobic component and aerobic component. Sometimes it's very difficult to predict what's going to happen to blood glucose level. So here is the challenge, that it is actually, even as a consultant, as a doctor, as a diabetes educator, and also as a person with type 1 diabetes, you don't know what to do. You simply don't know because the situation is changing. So monitoring is the key. I think just understanding that without monitoring, exercise is like riding a car without a mirror, or not able to see. It is as that bad, blindfolded if you're riding a car. It's like that. So you have to test, analyze the result, adjust the doses, plan your nutritional intake, and test again. It's not like a one time thing. So it's a cycle which goes on and on and on. It sounds very tiresome. It sounds like, who's going to do that? They do. I have so many runners sitting in this audience, and they do that again and again. But once they do it again and again, I'll come to that, how they adjust. But CGMS is highly recommended. If a person is going to be on a regular physical activity, especially of a next level, if it is sports, and if it is going to be especially competitive sports, then I would strongly, strongly recommend it to be CGM. I would at this time also say that I come from a resource poor area, and I have 1,500 kids, and we have 200 sports warriors, right? And we do like a 25-kilometer challenge trick twice, thrice a year, and yet they do it on SMBG. So when you don't have a CGMS, you can devise a policy. So we have devised a whole parameter where 24 hours before, from the night, key is again monitoring. We do not have CGM for all of them, but they would check their sugar, plan the carbohydrate intake, and how much distance are going to walk, how much calories are they going to burn, and accordingly they will pack one carbohydrate, one carb count snack in their bags and carry it throughout the track, and keep checking their sugar so that they can refill when needed. So vigilance. If we have CGM, wonderful, because you have the ongoing levels, you also have the trends. It becomes so much easier to take a decision when you know the trend, whether it's going down or static, or is it going up. Then preventing hypoglycemia and, of course, hyperglycemia. But if you are into sports, please look at CGM with a slight more care, because there are factors into active sports which can change its level. For example, oxygen levels, the sensor can be displaced in some of the sports. That can cause changes because your sugar levels are rapidly fluctuating. That can cause a change in the outcomes which your CGMS is showing. Again, the circulation is changing, your body temperature is changing. So CGM can sometime malfunction during active sport where you need it most. So if you are treating hypoglycemia with a CGM during sports, try cross-checking with a glucometer, and that is a very good procedure. That's a good SOP to have. So there are a lot of strategies. I will just say very simply, a safe BG. This is a ISPAD and RSSTI guidelines. A safe target during exercise is said to be between 125 and 270. If one has hypoglycemic unawareness, then having a lower, so keeping the low target high is always better. Keeping the low at 145 and not 125 would be good. If you are on a CGMS, set your alert at least 100. Do not keep it at 70, which would be its normal setting. Again, you see the arrows, and accordingly you will have the carbohydrate that you will supplement. Nocturnal blood glucose for everyone here, no matter what. You went for a trek in the morning, that night is very important. So it's like a 48-hour thing. If you are doing a trek in the morning, or a game in the morning, or sports in the morning, it's your journey starts the previous night and ends after 48 hours, the next day morning, because you're going to get very, very likely the person is going to get hypoglycemia in that. It's a latent hypoglycemia that is seen. So CGM, there would be alerts, but if not, then blood glucose monitoring is absolutely necessary. So meal and insulin adjustment before and after exercise, and at bedtime. Repeatedly, I'm not here giving you the entire physiology of sports. There's a very good sports session at the end of it for those who are interested at 4:30 in Ahmedabad Hall. I'm just trying to sensitize you that yes, everything can be done, but yes, monitoring and your meal and your insulin has to be adjusted before and after. Everyone knows. If it's a long duration, in between, everyone knows. Bedtime, and if needed 2 a.m., 3 a.m. is something I want to emphasize here. So, at the start of exercise, during exercise, post exercise, bedtime, and 2 or 3 a.m. if you're on SMBG, if on CGMS, setting your alerts right so that you can bolus accordingly, or you can take your carb snack accordingly. Now, what would you like to take when you're there? Because we need fluids. And if continuous fluid intake has to be taken care of, we know when you get dehydrated, the blood sugar level, that's one contributing factor to a rising blood glucose level. And also, we know that more dehydration can lead to ketosis as well. So, it's very important to keep sipping. Good fluids would be water or nimbu pani or buttermilk or jaljeera. This could be with a little salt and sugar that will help to prevent dehydration and keep the electrolytes going. For short duration activity, plain water is enough. One doesn't really have to have anything up to 1 hour. But after that, it's important to have additional carbohydrates, and that will also enhance the performance. Of course, you also would be able to maintain your blood sugar level. So this is very important. Fluid intake should be enough to ensure no more than 2% of body weight loss. So people are doing marathons, they're doing ultra marathons, people are now athletes at every level. So it's very important that there has to be enough fluid not to lose more than 2% of your body weight. Again, post-exercise hydration is very important, and this would be around 500 ml of fluid for every half kg weight loss that has happened. Now, there would be also unplanned activity, and that is the surprise part. So, if it's a short duration, you may not have to do something. You can test and take a small snack post exercise, right? But if it is of a longer duration and has a high intensity, then you will need a fast acting carbohydrate, and that is something to keep in mind. And accordingly, evening bolus, night bolus, bedtime, 2 a.m., and I cannot emphasize it enough. Most people manage their blood sugar during the exercise. It is the evening, the night, and the next day morning effects which are dangerous and which are usually missed, and people get overconfident about it. So, this is just to conclude that it is a science. Yes, please learn more about it. There are a lot of papers, there are a lot of studies, there are some very own RSSDI guidelines. ADA, Lancet covers this topic very well. ISPAD has a very good chapter on it. So, whoever is interested, please do go into the sports physiology, the whole mechanisms, and learn it, because that's something we can give like a prescription, like we do medical nutrition therapy. In a person with type 1 diabetes, it's very important we also give a exercise as a prescription, where we also, like in nutrition, we would manage the carbs, you'd ask how to bolus, you'll use the ISF, the ICR. Similarly, in exercise, it's important to provide a flow chart. That would be too much for this time to do in 10 minutes entire by itself, but that is something we should know if we are interested and if we are prescribing exercise to people living with type 1 diabetes. But I would conclude by saying, yes, it's a science. Yes, there's a lot of theory. Please know about aerobic and aerobic mix exercise, carb intake, fluid replacement, insulin on board, how much insulin to take. Yes, but at the same time, it is a trial and error learning cycle. I think everyone who has been exercising themselves know that's the only way to do it. Your body is different from another person's body. Your body behaves differently from what was given in the guideline. So the only way to do it, once you follow the guideline, you please document, but the only way is attempt it, evaluate it, adjust it, and then repeat it. So once you do it a couple of times, you will know that this is what happens when I run at XYZ speed. And this is what brings it down. I don't need to bolus. I just need to slow down. I don't want to do this. I just need to have a drink of water. So these are the things your body will tell you, and they work beautifully. So I will end by saying that don't stop exercise. It looks daunting. It looks like there's so many factors involved. But as I said, if you start doing it, listening, re-evaluating it, and again putting the things for yourself. How will you combine all the five factors together? There are 48 factors, right, which influence blood sugar levels. But let's look at the five that are in your hands. You're not going to change the temperature. You're not going to change the day of your menstrual cycle. So, what you can do is have that knowledge and adjust accordingly. But keep going strong but safely. I see T1D community here, and I would again ask you, your strength is not just exercising and climbing a mountain. Your strength is doing it safely. See Sidhu, and he was with me. He's from Bangalore, and we were there in Kalsubai, first India's first one-up trek. I had taken 23 Type 1 champions from all over India. Sidhu was there with me at that time. And one of the boys from Kolkata on top of the mountain while it was raining in a tent, and he was conversing. I was like, what happened? I thought there was a wild animal. And when I rushed out, he was in severe hypoglycemia. And later on, after, I mean, it was crazy how we handled that and finally came back. But later on, he said, oh, this happens to me all the time. And he was still sent for a Kalsubai expedition. I don't want to name any names, but I know how many times I died that night on top of the hill because I was with 23 young people I was responsible for. So that's not smart. That's not being heroic. That's being stupid. Okay. So you have to be safe and then you have to be strong. And that is my message to everyone. Thank you so much.